Good morning, ladies and gentlemen. Welcome to the second day of the Saving Every Woman, Every Child Within Arm's Reach Summit. Please take your seats. Bonjour, mesdames et messieurs. Bienvenue.
Good morning, ladies and gentlemen, and welcome to the second day of the Saving Every Woman, Every Child Summit Within Arm's Reach. I would now like to invite you to please sit down.
Ladies and gentlemen, please welcome your MC, Mrs. Lois Brown, Parliamentary Secretary to Canada's Minister of International Development, Secrétaire parlementaire du Ministre du Développement International du Canada. Well, good morning. It is a great privilege and an honor to be your MC for the next 2 days. I sincerely hope that you all enjoyed and were as stimulated yesterday as I was with the discussions that we had. And I also hope that even after some rather long flights to get here, some of you have come from great distances, that you were able to participate in yesterday's reception. That Impact Expo had some amazing examples of Canada's innovative work in maternal, newborn, and child health. And I think that we have truly gotten this summit off to a great start. Canadians and global citizens in the world are also participating in this summit virtually via social media, and I invite you to join the online conversations too, and tweet, if you would, using the official summit hashtag #SavingLives, or #Sauver des vies en français. We hope that everyone here will also join our #SavingLives Thunderclap. Now, if you're new to Thunderclap, as I am, it's an easy-to-use online tool that you can sign into using your personal Twitter or Facebook accounts, and with one click, your voice and support for this important cause can be amplified along with so many others. Now let's begin. We have had a very busy and exciting day yesterday, and we have an even busier and more exciting day in store for you today. And to start things off, I am very pleased to introduce to you my colleague, le Honourable Christian Paradis, Canada's Ministre de l'International Développement et la Francophonie, and he will introduce his opening remarks.
Merci beaucoup, Lois. Thank you very much. Good morning, Your Majesty, Queen Rania Abdullah, Your Highness the Aga Khan, Your Excellency, President Kikwete, Right Honourable Prime Minister Harper, heads of international agencies, ministers, distinguished guests. It's my distinct pleasure to welcome you to the second day of Canada's Saving Every Woman, Every Child Summit. For those who are just joining us today, welcome to Toronto. And for those of you who were with us yesterday, welcome back. I'd like to thank Prime Minister Harper and President Kikwete for kicking things off yesterday. They shared their personal insights on the results that have been achieved to date, and perhaps more importantly, on how we can forge a path together for the next phase of our efforts. The global effort to improve maternal, newborn, and child health is already a story of success, a story of what we can accomplish when we work together towards a common vision, a story of the incredible results we have been delivering and will continue to deliver for women and children. Nos efforts internationaux.
Our international efforts started with the Millennium Development Objectives, goals, which brought together the entire world around these goals. And then Canada had the Muskoka Initiative at the G8 Summit in 2010 to bring the world's attention on the issue of maternal, newborn, and child health to reduce the number of deaths of mothers and children. The Muskoka Initiative allowed the United Nations shortly after to launch the initiative Saving Every Woman, Every Child. And we have seen the results coming from this international initiative. We have seen a diminishing rate of deaths. Millions of children now live beyond the age of 5 years old, and lives of tens of thousands of women, of mothers, have been saved. This is fundamental, not only for these women, but for their families, for their communities as well. A child who lives a healthy life obviously can reach his or her full potential and can contribute to the success of his or her family, community, and economy. But as you know, there is still a lot to be done to complete the work that was launched. We will need a sustained political leadership. Each and every actor will have to take responsibility regarding the results
of both the Muskoka and the UN Every Woman, Every Child initiatives. Quite frankly, this has changed the way we work as a global community. Accountability is not about simply cutting a check. It's about turning our commitments into concrete action. It's about delivering on our pledges and promises. And it's about committing together to mutual accountability, recognizing that we cannot achieve these goals alone. It's also about improving systems for global reporting and oversight. Our aim is not to create new mechanisms. It is to harmonize, strengthen, and align existing ones so we can better track commitments and measure results. Today we will tackle how we can work together to increase our accountability, how we can spark innovative financing, how we can deepen existing partnerships and create new ones, how we can move the needle to the left on newborn deaths, and how we can accelerate progress on maternal health. Aujourd'hui, nous chercherons
Today, we will launch a plan to prevent needless deaths of women and children everywhere in the world. So it is within our reach, but to do so, we have to be more audacious, we have to innovate more, we have to work more efficiently. There will be a lot of dialogue here today, but this dialogue has to be followed by true action, and these actions must lead to better results, not solely for governments, for donors, or for NGOs. We're talking here about results for people who truly need to see these results. Millions of women and children internationally who are fighting for their lives. This summit is not for us. This summit is for them. So by working together, we can eliminate these unnecessary deaths of mothers and children. We can save millions of lives. And I would like to thank you
of your day.
Thank you, Minister. Our first speaker this morning is Ms. Hannah Godefa, Goodwill Ambassador for UNICEF Ethiopia. Hannah's humanitarian work started at the age of 7 when she was visiting her relatives in rural Ethiopia. She found out that she would not be able to be pen pals with some of the school children because of lack of school supplies. So Hannah founded the Pencil Mountain Project, which has since delivered close to 500,000 pencils to thousands of children in Ethiopia. And since then, Hannah has become a symbol of education and change for many children around the world. At 16 years of age, she is wise beyond her years. Please help me welcome Hannah Godefa.
Thank you for that wonderful introduction, and good morning, distinguished guests, ladies and gentlemen. It is an absolute honor for me to be here with all of you today. I am also honored to be the youngest person to speak to you during this summit. While I, of course, can never claim to speak on behalf of all young people, I do hope that my remarks will give you a glimpse of some of the hopes and dreams that at least one young person has for our world. I am a Canadian, but like many other Canadians, I have ties to another country. My parents are originally from Ethiopia, and I have returned there many times. I have seen firsthand that many children in Ethiopia live a very different life from the life that I know here in Toronto. When I was 7, I started a project called Pencil Mountain that has delivered 500,000 school supplies to Ethiopian school children. Since that time, my dream has been to do what I can to help girls around the world. My role as a UNICEF National Ambassador for Ethiopia allows me to do just that. It has given me a unique opportunity to speak to you today. And while it is absolutely humbling to be in a room full of so many influential people, I have to say that the most inspiring experiences for me have been the opportunities that I have had to meet the women and children that we are all here today to help. On one visit, I arrived in the Akura village in Gambela, Ethiopia, after a 2-hour boat ride from the closest town. I saw how the government of Ethiopia, UNICEF, with the support of Canada, have partnered to provide women and children in that remote village with the health care that is their right. I was amazed to see how the health extension workers, who are recruited from these rural communities, care for pregnant mothers, newborns, young children, and educate families about healthy living. I found the women I met to be energetic, committed, and doing an absolutely extraordinary job. I learned that neonatal infections, which are a major cause of infant deaths in Ethiopia, can be prevented by visits in the first few days of birth from committed, qualified health extension workers. At the international level, in 2012, the government of Ethiopia, along with the governments of India and the United States, and together with UNICEF, have launched a Promise Renewed, which is a global movement to end preventable child deaths. According to A Promise Renewed, dramatic reductions in preventable child deaths can be achieved through concentrated action in 5 key areas, which are scaling up efforts in countries that account for the greatest percentage of child deaths, as well as strengthening health systems, addressing 5 key killers, investing in education for girls and women, and building broad-based political support for maternal, newborn, and child survival. 177 countries, including my own country, Canada, have taken this pledge. For Ethiopia, taking action in line with the Promise Renewed includes training and developing community-based health workers. Because of the 38,000 health extension workers who are mainly women, the country has made significant progress in providing healthcare services like vaccines and medicines to treat malaria, pneumonia, and promote breastfeeding. The work of the health extension workers has helped to greatly reduce child mortality rates in Ethiopia. These are the experiences that make me proud of our global community. These are the experiences that make me proud to be Canadian. And these are the experiences that show me that change is possible. But I have also met with children in Juba, South Sudan, who are suffering greatly from illnesses that can be easily prevented with access to basic medicines that I could get easily here in Canada. These are the experiences that motivate me to do more and motivate me to ask you to do more as well. The fact that all children and young people around the world do not have access to critical health care is unacceptable, and it must change. Now, it has never slipped my mind that life could have been very different if I was born in one of these rural villages. I could have started life without a birth certificate, faced potential illness or death in the first few days of life, lost out on the chance to be immunized, and then married as a child, lost my chance to be educated, and then faced further health risks as a young pregnant teenager. But instead, I was born in Canada. I was born in a country that recognizes our collective responsibility to give every child the opportunity to grow up healthy, happy, and safe. I am very proud of the Canadian leadership that has brought us all here today. Now, I said I wanted to share with you all my hopes and dreams. So I hope that we can bring our ideas and efforts together to save lives. I hope that we can redouble our efforts and be catalysts for change. And I urge all of you here today to renew your promise to the women and children of this world and commit to taking concrete actions to end the preventable deaths of women and children. Because I don't just want a world where all children are healthy and happy and safe to be just a dream. I want it to be a reality. Thank you.
Thank you, Hannah. You truly are an inspiring young woman, and we thank you for the initiatives that you have undertaken. Thank you for being such a great spokesperson. Ladies and gentlemen, I am now very honored to introduce our next keynote speaker. As chairman of the Aga Khan Development Network, His Highness the Aga Khan has had a deep engagement with development for more than 50 years. With his leadership, the network's development agencies have improved the quality of life for millions of people around the world. Today, the network is a major institutional player in maternal, newborn, and child health in parts of Africa and in Asia. His Highness the Aga Khan's personal leadership on issues of women's and children's health has been long-standing and visionary, and he continues to be an ambitious founder of new institutions that will provide the developing world with the capacity to lead the response to maternal, newborn, and child health issues for decades to come. Please give a warm welcome to His Highness the Aga Khan.
Thank you, Mrs. Brown, for that kind introduction. Bismillahirrahmanirrahim. Prime Minister Harper, President Kikwete, Your Majesty, Your Excellencies, Honourable Ministers, distinguished guests, ladies and gentlemen. Like you, I am here today because of my conviction that improving maternal, neonatal, and child health should be one of the highest priorities on the global development agenda. I can think of no other field in which a well-directed effort can make as great or as rapid an impact. I am here as well because of my enormous respect for the leadership of the Government of Canada in addressing this challenge. And I'm here too because of the strong sense of partnership which our Aga Khan Development Network has long experienced working with Canada in this critical field. Leadership and partnership. Those are words that come quickly to mind as I salute our hosts today, and as I greet these distinguished leaders and partners in this audience. Mr. Prime Minister, I recall how our partnerships were strengthened 4 years ago when you launched the Muskoka Initiative. It led to an important new effort in which our network has been deeply involved in countries such as Afghanistan, Pakistan, Tanzania, Mozambique, and Mali. In all of these efforts, we have built on our strong history of work in this field. It was 90 years ago that my late grandfather founded the Karada maternity home in Karachi. In that same city, for the last 30 years, the Aga Khan University has worked on the cutting edge of research and education in this field, including its new specialized degree in midwifery. One of our Aga Khan University scholars helped fashion the new series of reports on this topic that was released last week, an effort that involved more than 54 experts from 28 institutions in 17 countries. The reports tell us that right, intensified steps can save the lives of an additional 3 million mothers and children annually. To that end, our development network has also focused on building durable, resilient healthcare systems. One example is the not-for-profit health system by the Aga Khan Health Services in northern Pakistan, a community-based network of facilities and health workers, including a growing number of nurse midwives. We have extended these approaches to other countries, including a remarkable partnership in Tanzania, funded by the Canadian government, and implemented in close partnership with the Tanzanian government. Another such AKDN activity now serves some 2.5 million people in 15 countries, with 180 health centers, both in urban and rural areas, often in high conflict zones, and embracing some of the world's poorest and most remote populations. Last year alone, these facilities served nearly 5 million visitors, inpatients and outpatients, with more than 40,000 newborn deliveries. So our experience has been considerable. But what have we learnt from it? Let me share a quick overview. First, I would underline that our approaches have to be long-term. Sporadic interventions produce sporadic results, and each new burst of attention and activity must then start over again. The key to sustained progress is the creation of sustainable systems. Second, our approaches should be community-oriented. Outside assistance is vital, but sustainable success will depend on a strong sense of local ownership. The third point I would make is that our approaches should support the broad spectrum of healthcare. Focusing too narrowly on high-impact primary care has not worked well. Improved secondary and tertiary care is also absolutely essential. Our approaches should encourage new financial models. Donor funding will be critical, but we cannot sustain programs that depend on continuing bursts of outside money. Let me underscore, for example, the potential of local savings groups and microinsurance programs, as well as the underutilized potential for debt financing. Also, and I think this is very, very important indeed, we have watched for many years as many developing countries, and their economies, of course, have created new financial wherewithal among their people. These growing private resources can and I think should help social progress, motivated by developing social consciousness and by government policies that encourage tax-privileged donations to such causes. Our approaches should also focus on reaching those who are hardest to reach. And here, new telecommunications technologies can make an enormous impact. One example has been the high-speed broadband link provided by Roshan Telecommunications, one of our network's companies, between our facilities in Karachi and several localities in Afghanistan and in Tajikistan. This e-medicine link can carry high-quality radiological images and lab results. It can facilitate consultations among patients, doctors and specialists at various centers. And it can contribute enormously to the effective teaching of health professionals in remote areas. Our approaches should be comprehensive, working across the broad spectrum of social development. The problems we face have multiple causes, and single-minded vertical interventions often fall short. The challenges are multi-sectoral, and they will require the effective coordination of multiple inputs. Creative collaboration must be our watchword. This is one reason for the growing importance of public-private partnerships. These then are the points I would emphasize in looking back at our experience. I hope they might be helpful as we now move into the future and to the renewal and re-expression of the post-millennium development goals. As we undertake the new planning process, the opportunity to exchange ideas at meetings of this sort can be enormously helpful, and potential partners must be able to talk well together if they're going to work well together. I would hope such occasions will be characterized by candid exchange, including an acknowledgement of where we have fallen short and how we can do better. The truth is that our efforts have been insufficient and uneven. We have not met the post-millennium development goals. At the same time, we must avoid the risk of frustration that sometimes accompanies a moment of reassessment. Our challenge, as always, is a balance between honest realism with hopeful optimism. And surely there are reasons to be optimistic. In no other development field is the potential leverage for progress greater than the field of maternal and newborn health. I've spoken today about some of the approaches that have been part of our past work, but I thought I might close by talking about some of the results. My example comes from Afghanistan, a heartening example from a challenging environment. The rural province of Afghan Badakhshan once had minimal infrastructure and few health-related resources. Less than a decade ago, it had the highest maternity mortality ratio ever documented. It was about at that time that the Afghan government, supported by international donors, contracted with the Afghan Health Service to create a single non-governmental health organization in each district and in each province. Today, the Badakhshan system alone includes nearly 400 health workers, 35 health centers, 2 hospitals, serving 400,000 people. Its community midwifery school has graduated over 100 young women. The impact has been striking. In Badakhshan in 2005, 6% of mothers died in childbirth. That is 6,000 for every 100,000 births. Just 8 years later, that number was down 20-fold. For every 100,000 live births, death has gone from 6,000 down to 300. Meanwhile, infant mortality in Badakhshan has fallen by 3/4, from over 20% to less than 6%. For most of the world, science has completely transformed the way life begins and the risks associated with childbirth. But enormous gaps still exist. These gaps are not the result of fate. They are not inevitable. They can be changed, and changed dramatically. When government and private institutions coordinate effectively in challenging a major public problem, as this example demonstrates, we can achieve substantial, genuine, quantifiable progress, and fairly rapidly. This is the story we need to remember, and this is the sort of action we need to take as leaders and as partners in addressing one of the world's most critical challenges. Thank you.
Thank you, Your Highness, for those remarks. I was privileged to meet with members of your staff for the foundation in Madagascar and Mozambique most recently, and you are to be highly commended for the work that is being done there to change lives. I always wanted to be taller. I'm suddenly taller. I didn't know it was so easy. Our next speaker is arguably the most influential female in the Arab world. She is an outspoken philanthropic activist, a passionate advocate for women and girls' rights, and a devoted mother of 4. We are thrilled to have her with us, and I would ask you to please welcome to the stage Her Majesty Queen Rania Abdullah.
Your Highness the Aga Khan, President Kikwete, Prime Minister Harper, Minister Paradis, honorable guests, ladies and gentlemen. Thank you, Ms. Brown, for your warm words. It's a pleasure to be here. You introduced me as Queen, but I have to tell you, I have a bigger title than that. It's Mom. Mom to Hussein, Iman, Salma, and Hashim. That's the title that matters most. There's nothing more important than nurturing them, making them feel loved and secure, watching them grow up, and celebrating their milestones. One such milestone will happen next week when my eldest daughter, Iman, graduates high school. I won't lie, half of me is apprehensive about seeing her go off to university. The other half is bursting with pride. It's part of the emotional roller coaster of being a mother, a parent, and I wouldn't miss it for the world. Every parent should be able to celebrate those milestone moments, from pregnancy, birth, and the first month of life, to that 5th birthday, that first day of school, and so many more. And in recent years, millions more parents have enjoyed those moments. Since 1990, we've seen a 45% reduction in maternal deaths. The global under 5 mortality rate has roughly halved. Canada's leadership has been central to this progress. The first Muskoka initiative galvanized global support to reduce maternal and child mortality. I also know from my work on the UNF board how the Secretary General's dynamic global partnership, Every Woman, Every Child, has contributed to this progress by mobilizing governments, partners, and NGOs on behalf of women and children. And as a proud advocate of UNICEF, I want to spotlight their great work in helping to reduce under 5 mortality, most recently through A Promise Renewed, the initiative which aims to end preventable child death. I also know, but for all our progress, the milestones of which I spoke are a distant dream for millions of mothers and their children. For them, milestones are measured not in triumphs, but in tears, not in laughter, but in loss, not in births, but in burials. Every minute and a half, a woman dies from complications of pregnancy or childbirth. Every day, 18,000 children under 5 die from causes we can prevent. And every year, 2.9 million newborns die. That's a little more than the population here in Toronto. An additional 2.6 million babies are stillborn. Another Toronto. The mother of modern nursing, Florence Nightingale, said, "Were there none who were discontented with what they have, the world would never reach anything better." Ladies and gentlemen, these figures are more than a source of discontent. They're an outrage, an injustice, and they have no place in our common humanity. So, thank you to Prime Minister Harper and the Canadian government for being discontented with the status quo and for helping us to reach something better. So, how do we reach something better? We can get behind the soon-to-be-launched Every Newborn Action Plan, which breathes new life into the UN's Global Strategy for Women and Children's Health. Because while we've seen progress to reduce child deaths worldwide, neonatal deaths have declined at a slower pace, and in some instances even increased. As a mother, I know how precious those first days are. It breaks my heart to think that when babies are at their most helpless, we seem least able to help them. It's all the more cruel because we know how to help them. Up to 2/3 of these deaths could be avoided if skilled health workers attended births and were in hand in the first week of life. The action plan is our best chance yet to change the birth of a child from something to be feared into what it should be, a cause for celebration. To reach something better, we must reach into conflict-affected countries. The civil war in Syria has shattered the health system. Care for pregnant women, mothers, and their newborns is at best precarious. I'm thinking about the woman who gave birth on the doorstep of a hospital, even as the hospital was bombed. Or the woman just last month forced to give birth on the Lebanese street because she couldn't pay the hospital up front. Or the woman so traumatized by the death of her husband and finding shelter for her family that she went into labor at 7 months. With no hospital nearby, friends helped to deliver her baby son. He lived for 2 hours. In neighboring countries, the absence of fighting is replaced with the agony of uncertainty. Last year in Jordan, more than 10,000 Syrian babies were born refugees. Most new mothers look forward to taking their babies home. But for these mothers, there is no home, nor hope. Worse yet, the majority of babies born as refugees don't have their births officially registered. In Lebanon last October, only a quarter of the babies born had birth certificates. These babies are, as Carl Sandburg tells us, God's opinion that the world should go on. They are the future of Syria, the stability of the region. But right now, the odds are stacked against them. They and their mothers desperately need your support. The third way we can reach something better is by investing in girls' education. Educated girls can transform nations. They're troublesome like that. That's why Boko Haram fear them and why the Taliban shot Malala. Girls just can't keep education to themselves. They spread it around. They teach their mothers to read. They stand up for themselves and those around them. They get married later and send their children to school. In fact, the child of a literate mother is 50% more likely to survive past the age of 5 than the child of a mother with no schooling. So let's get girls into classrooms. We can reach something better by putting girls and women at the heart of the post-2015 agenda. As I just said, girls and women are the backbone of development progress. That's why in my time on the high-level panel, we urged that gender equality not only permeate all the new development goals, but also that it be a standalone goal. And when I say girls and women, I mean all girls and women. In slums, in remote foothills, in factories and quarries working all day long, in deserts searching for water. We must find them. We must give them tools to help them fulfill their potential and change mindsets. If we don't put girls and women at the heart of the post-2015 agenda, we will be having this same conversation 15 or 20 years from now on our way to Muskoka, number 9. Last, we can reach something better by being more innovative. The great thing about innovation is that it doesn't always mean spending a lot of money. Quite the opposite, in fact. Take the humble mobile phone. Reports suggest that this year, the number of active cell phones will reach 7.3 billion. In other words, there will be more in-use cell phones than there are people on the planet right now. 2 out of every 3 of these new mobile phone subscribers are women. What does this mean for maternal, newborn, and child health? It means that women in the poorest communities furthest from healthcare can access basic medical information. It means that community health workers can track pregnancies and connect to doctors. In other words, it means a doctor in their pocket, a prescription in their hand, and a healthier future at their fingertips. Ladies and gentlemen, there are so many ways we can reach something better for mothers newborns, and children, especially when we do more together globally. So let's take inspiration once more from the mother of modern nursing who, when asked to what she attributed her success, said, "I never gave or took any excuses." Good advice. No more excuses. Thank you.
Thank you, Your Majesty. When you tell those stories, you remind us of how precious each and every life is. And you're right, it's time that we had no more excuses. Ladies and gentlemen, it is my honor to introduce our final keynote speaker for this morning, His Excellency Jakaya M. Kikwete, President of the United Republic of Tanzania. President Kikwete's efforts to improve maternal, newborn, and child health in his country is a testament to what can be achieved when a leader puts the health of women and children at the forefront of his country's priorities. Under President Kikwete's leadership, Tanzania has already exceeded MDG 4 targets by reducing infant and child mortality by 2/3. It is also on track to meet MDG 6 to reduce the prevalence of HIV/AIDS to less than 5.5%. This is an incredible victory for all Tanzanians. He was on stage yesterday for the opening plenary with our Prime Minister. Please welcome back to the stage a very warm welcome for President Kikwete.
Thank you for the kind words about me and my country. Our host, Right Honourable Stephen Harper, Prime Minister of Canada, Majesty Queen Rania of Jordan, Highness the Aga Khan, friends and members of this noble fraternity working hard to save the lives of innocent mothers and children. Excellencies, once again allow me to commend Prime Minister Harper for conceiving the idea of convening this important summit on maternal, newborn, and child health. I congratulate him also for the wonderful organization. Prime Minister Harper has demonstrated exemplary leadership on this all-important matter, from Muskoka to the UN Commission on Information and Accountability for Women's and Children's Health, through several initiatives to this summit today. We sincerely appreciate the good work you are doing. Mr. Prime Minister, I'm sure I speak on behalf of many people on this planet when I say, keep up the good work. Excellencies, I'm delighted to join you this morning at this important session on doing more together globally. I subscribe to the idea that doing more together is the best way to go. Our past and recent experience in addressing issues of women's and children's health have not suggested otherwise. It's imperative that we build upon this experience of working together as we count down towards 2015 MDGs deadline and for post-2015 phase that is dawning. Your Majesty, Highness, Excellencies, ladies and gentlemen, Tanzania's experience in implementing MDG 4 and 5 has taught us many lessons as we travel towards the 2015 deadline and chart the path towards post-2015 development agenda. I say so because the results tell the story about the successes made or can be made and the challenges that deserve continued attention going forward. As we examine this experience, it is important to note that Tanzania was worse off before the proclamation of the MDGs than where we are today. At the dawn of the new millennium, maternal mortality rate was 870 for every 100,000 live births. Infant mortality was 115 for every 1,000 live births. Under 5 mortality was 191 for every 1,000 live births. The coverage of contraceptives was 7% only, and 43% of women gave birth under the care of skilled health personnel. When the MDG 4 and 5 targets were announced, to us it appeared to be too ambitious goals to attain. But we said, we have to rise to the challenge. We were supposed to lower maternal mortality to 193 for every 100,000 live births. As I said, it was 870. We're supposed to bring down neonatal mortality to 19 deaths for every 1,000 live births, and under 5 mortality to 54 for every 1,000 live births, from 191 by 2015. Today, less than 600 days towards that deadline, Tanzania's maternal mortality rate has come down to 454 from 870, a 45% decline. Neonatal has come down to 26 from 119. Under 5 mortality has come down to 54. The use of contraceptives has increased to 27%, with 25% unmet needs. And women who give birth to at health facilities under the care of skilled midwives or health professionals is now at 51%. Indeed, in the span of 14 years, comparatively a lot of ground has been covered and much more has been achieved. Tanzania has met the MDG target for under 5 mortality, reducing it by 2/3. We are very close to meeting the neonatal mortality rate, which I'm sure by next year we should be able to overcome that. But we are far from meeting the target with regard to maternal mortality. As I said, we have done 45%. We are supposed to do 75%. We are also far behind with regards to the provision of skilled health professionals. It is clear from these statistics that we have made progress, but not good enough with regards to maternal mortality. But work is still in progress to accelerate the pace. As alluded to earlier, I'm hopeful we'll cover a lot of ground by 2015. These hard-won results have been achieved through a number of interventions undertaken through concerted efforts by our government, respective families and communities, but also through the support from our development partners, including bilaterals, the multilaterals, private sector, private foundations, and the wider civil society organizations. When I came into office in 2005, I made a promise to make healthcare one of the top priority agenda items of my administration. We immediately undertook a review of the health situation in the country and came up with a new health policy. But we also designed the primary health services development program to implement the policy. Subsequently also, on a number of we came up with specific policy instruments to deal with specific challenges in the health sector. With regards to maternal, newborn and child mortality or child health issues, we came up with a roadmap to accelerate the reduction of maternal, newborn and child death. We came up with an immunization costed plan, the family planning costed plan, human resource and health strategic plan, and now we have what we call the sharpened plan. These policy and programs were aimed at addressing access to health care and service delivery capacity-related bottlenecks. We gave ourselves the overarching ambition, first and foremost, to work hard to improve access to health care by building health delivery facilities within a radius of 5 kilometers from where people live. Also, we agreed to provide these facilities with the requisite equipment, medicines, as well as skilled health personnel. To implement these ambitious plans and programs, the government raised the health budget fivefold, from 271 billion Tanzanian shillings, which is equivalent to 170 million US dollars in 2007, to 1.4 trillion, which is equivalent close to $900 million in 2013. We moved it from 6th to the 3rd birth after education and infrastructure development. This investment is beginning to pay dividends. Working with the communities, 1,640 new dispensaries have been built, 122 new health centers, and 19 new hospitals have been built. There has been considerable improvement with the district, regional, and zonal hospitals, as well as the Muhimbili National Hospital, to take care of referral cases. Since 2007, we have upgraded many of the old dispensaries in the rural areas to enable them undertake birth-related surgeries. With health centers, we are building capacity to do cesarean section. We have expanded training and employment of health professionals. We have improved the availability of medical equipment, medicines, including vaccines. Besides addressing the accessibility challenges, but we also undertook specific measures which have helped to reduce maternal, newborn, and child mortality. With regard to child mortality, among the specific interventions that we have made, one is sustenance high immunization coverage. It is now over 93%. Improved malaria control increased coverage of integrated management of childhood illnesses, the coverage of improved nutrition, including coverage of vitamin A, which is now over 90% for children under 5. But also, there's a lot of improvement now with regards to breastfeeding. With neonates, besides the above measures, which also have helped with reduced neonatal mortality, but we have also taken specific measures to improve on our capacity to deal with asphyxia, pregnancy and birth-related complications, because these are also major causes of death among newborns. Take care of infectious diseases, but also deal with those who are born prematurely. With regards to mothers, measures include improved perinatal care, visitations to clinics is over 96%. Our biggest problem is giving birth. Only 51% give birth in bona fide health delivery facilities. But the factor here is distance. If the dispensary or the health center is 20 kilometers away, during pregnancy, at least during early pregnancy, a mother can walk or be taken by bicycle. But when in labor, that's not possible. So many of them give birth at home under the care of traditional birth attendants who don't have the skills when the pregnancy is complicated, or there are complications related to pregnancy, overbleeding, and so on. Of course, we also have increased coverage of intermittent preventive treatment for malaria, anemia, etc. We have made it, of course, through persuasion, that every pregnant woman gets tested for HIV and AIDS when visiting the clinics, so that those who are detected with a problem in good time, they are themselves managed. But also, we have a very robust program which we launched 3 years ago, which I launched 2 years ago with the support of Global Fund for prevention of mother to child transmission. Improved access to care and skilled personnel has also helped. As I said, we have not yet succeeded in that one, but the little that we have done has contributed to the reduction in maternal mortality. So what is required of us now is scaling up on these interventions. They have worked well, they have produced results. If we do more, we will definitely get better results in future. I commit myself to continue to increase the government budget for healthcare. We also believe with continued support from partners and friends like the bilaterals, like the government of Canada, and the other many governments in the developed world that are helping us, the support of the United Nations and UN agencies, WHO, I see Margaret is here, UNICEF, and other agencies of the UN, with the support of Global Fund in the fight against malaria, HIV/AIDS, and tuberculosis. Malaria is a major killer of women and children. Successes in controlling malaria immediately translates into more lives saved. Death from malaria among children has been cut over 50-60% in Tanzania because of measures of malaria control. Insecticide-treated bed nets, the use of artemisinin in combination therapy, indoor residual spraying. We are now working on larvicide, killing mosquitoes at their birthplaces. These interventions have has helped so much in reducing the death of mothers and children. So working with Global Fund and other partners, this fight is on. But private foundations, the Aga Khan Foundation, His Highness is here. They're doing a lot, training nurses, the university in Dar es Salaam. Other comprehensive programs on improved health care. Bill and Melinda Gates Foundation has been phenomenal in supporting our endeavors. In fact, one of those major supporters of our programs, and a lot of the success that we are talking here in terms of reduction in maternal, newborn, and child health has very much been contributed by what the Bill and Melinda Gates Foundation has done and supported us. We have other many players from the NGO community. Yesterday I had a meeting of the MNH fraternity here where the Prime Minister was meeting with them. I was pleasantly surprised to know how many of them are quite active in Tanzania. To you all, I thank you for your support. It has made a huge difference. So I believe continued cooperation and support, we should be able to do more, and we should be able to achieve more. In conclusion, let me say that I have shared with you our experience and our optimism for the days ahead of us. We have come a long way as far as maternal, newborn, and child health is concerned. What is clear is that the issue or the problem we are confronting is not about knowing what needs to be done, no lack of interest to do that. It is rather a function of capacity constraints on our side, which is very much associated with the level of development that we are in. Our experiences give us no reason to renege on the commitment and on the cause. I'm personally committed to see acceleration in the interventions as well as more accountability and better results so that we can get better results with regards to women's and children's health delivery by 2015 and beyond. Recently, we introduced a scorecard for every district to know exactly where they are on the various aspects with regards to maternal, newborn, and child health. 2 weeks ago, I had the opportunity of distributing them in person to the regional governors. I said, look at this scorecard. This is how good or how bad you are performing on the various indicators. Consolidate the gains, improve on the green so that on the yellow so that it also becomes green, but do more on the red so that you move from red to yellow. If you can move from red to green, that is even better. So everybody took it. Some of them were wishing they could hide their faces because they are scorecards. So this is the best way to me in terms of information and accountability. They wanted the reports to be given to me every 6 months. I said 6 months is too long. Let's meet in 3 months because I leave office in October next year. So if it has got to be 6 months, I'm not going to do it once. But I want to do it a few times so that at least people are used to this system of accountability. So I believe We have demonstrated how far we have gone with little resources and with the support that we are getting from our friends. We are certain that with improved health systems, more resources and accountability, we will be able to achieve our objectives. Fortunately, this world has enough resources. This world has plenty of wealth. This world has the knowledge, has the technology, but also there are plenty of people of goodwill. If the world works together in this noble cause, our objective will be realized in no time, saving women and children. Live their life to the fullest. Save them from dying from causes which can be prevented should remain our shared responsibility. This fight we must win, and win comprehensively. Losing is not an option. Thank you for your kind attention.
Thank you, President Kikwete. Thank you for your leadership on this initiative, and you have certainly let us know, you've underscored the fact that the goals are achievable, and we wish Tanzania great success as you move forward with these next accomplishments that you are about to undertake. You know, ladies and gentlemen, we have had some remarkable speakers here this morning, and I would like you to join with me once more in thanking them for their inspiring words. Many of you have had the opportunity to meet me over the last few years, and so you know that for me this is more than just an academic discussion. With a son-in-law from Ghana and my daughter currently living in West Africa, Africa is my family. So thank you. Ladies and gentlemen, this concludes the first part of our morning. There's time now for a 20-minute break. I am going to urge you, because we started a little bit late, to please try and keep it to the 20 minutes so that we can start with our next plenary session. It's going to be here in the Canada Room, and I'm sure that we are in for some really remarkable conversation. So have a great break, and see you soon.